So I've come to Sugarway, to the Botolph Bridge Pharmacy. We've got Patrick here, who's a pharmacist. Hello, Patrick.
Hello.
Now, I've heard the phrase pharmacy first. What does that mean?
What's been identified by the NHS is basically there's some illnesses, some conditions you don't want to wait. And obviously, getting with the GP, people having to wait maybe a few days, maybe longer. What they've done, working with doctors, they've identified a number of conditions which you don't want to wait. They're painful, you're feeling ill, but it doesn't need to be dealt with by a doctor. So they have put in place systems where you can go to the pharmacist and he can treat you for these conditions. And the great thing is you don't need an appointment. Take a ticket and wait, so to speak, and you will be seen by someone.
And I guess the wait time will be a lot less than, say, trying to book a GP appointment, or even, as some people do, going to the hospital, to the walk-in centres or something.
Exactly. So the wait time is typically about 20 minutes. And what the pharmacist has been trained to do is, look, is this something that will probably get better with a little bit of antibiotics or not? If it's not, we have to send you one of two places. Either we say, look, this is more of a long-term thing. That's better done by the GP. But hopefully it's not anything urgent. It's nothing urgent.
So the non-urgent types of things that we might normally go and see a GP for, consider coming to see your local pharmacist. What kind of conditions are we looking at?
So have you got a rash? Have you got a sore throat? Have you got cold and flu symptoms? Come down and we can assess you, because if it's, say, impetigo, you'll get antibiotics. If it's sinusitis, you'll get antibiotics. So come down, talk to us. Maybe we can treat you, but if we can't, we'll send you in the right direction.
Yeah. So you'll get seen, and if you can be treated, great. If not, you'll then just get told, okay, go and see your GP.
Yeah. GP, A&E sometimes. Sometimes it might even be, you can go back home, there's no urgency. Come back in a few days if you don't feel better.
Yeah. Or call 111.
And also 111, yes, yeah. A fantastic service, which we do refer people to reasonably often. Where, okay, you don't want to wait, we can't treat you, but 111 will. And we have a good knowledge as well of what 111 will treat. So when we say go 111, you won't get palmed off.
Are there lots and lots of pharmacies across the whole of the Peterborough area that are kind of signed up to this whole pharmacy first thing?
Every pharmacy. Yeah, and also pharmacist training is changing. A lot of us have trained retrospectively, like we've upped our skills, but the new pharmacists coming out, the emphasis of the training is on this sort of patient face-to-face consultations. So it's becoming the new norm in pharmacies. We're trying to get the word out there.
Yeah, trying to get the word out there is the key thing, isn't it? And in fact, you can probably hear behind us, we're in the pharmacy now. The pharmacists just through the door there are meeting potential patients. How important is it that pharmacy first works? How under strain are our GPs, are our hospitals, would you say?
It's very important. The first place I went to when we began the service, I went to the GP receptionists. They are so grateful that they have somewhere to send someone when they run out of consultations. Also, a large number of people I see, they may have ended up in A&E, but because we were able to do an early intervention, give them a treatment, the illness is being treated instead of it getting worse and worse, and you end up in that queue in the A&E. So it's taken pressure off the doctors, it's taken pressure off A&E as well. And most importantly, the patients can access the treatment they need, which is number one.
Yeah, and quicker. Are you not worried that the pharmacies themselves will become a little bit overburdened, or does that not worry you?
Not at all. Pharmacy has always really been able to adapt to new challenges, and we do innovate and we change how we work to adapt to the workload. So last thing we want is people avoiding coming here. You know, we want people through the door.
Okay. Pharmacy first. If you've got maybe a non-urgent condition, perhaps some kind of, if you're feeling a little bit poorly, come to your pharmacy, come to your local pharmacy, speak to them, and maybe your treatment will be that much quicker. Two other things I want to ask about. I want to come on to stop smoking in a moment, because I know that pharmacies can offer a lot of support for anyone wishing to stop smoking, but it's winter time, it's flu season. How important is it to get that flu jab, would you say?
Any vaccination program, it's really important people participate. Obviously, we've had COVID, flu as well, get yourself protected. Really, it's something you're doing for the whole community. Maybe you think yourself, I don't get flu, but what if you were to pass it on to someone else who's vulnerable? If you're eligible for the flu jab, maybe you're going to save a hospital bed, because if you catch flu and you're vulnerable, you might end up in hospital. Get vaccinated, keep that bed free for someone else.
Yeah. So finally, Patrick, let's talk about quitting smoking. It seems a little bit odd to me that pharmacies are places where people can get help and support, but actually it is the case. And I guess as we approach Christmas and New Year, if there's people listening to us talking now who have had it in their mind to consider stopping smoking, what support, what advice is there from pharmacies to help people do that?
Well, of course, we do sell a full range of nicotine replacement products, but we're also trained in giving advice on and interventions on helping you stop smoking. We can also signpost you to other areas of the NHS where they can perhaps put you on a programme to stop smoking. It's always worth stopping smoking. You need your lungs, and every day that you're smoking, you are damaging them. You want them to last as long as possible. One of the real issues, people think cancer, but COPD, that's the real thing with smoking, where basically your lungs slowly lose their function. Happens slowly over time, but once it's gone, quality of life afterwards, it's a struggle.
You need to look after those lungs.
Yeah.
So if it's in your mind to consider stopping, go to your local pharmacy and talk to them.
Yes, absolutely. Pop down, ask for a consultation. We will help you.
Thank you so much for your time. It's a super busy little pharmacy, this in Sugarway, Botolph Bridge. So Patrick, to you and your team, Merry Christmas and thank you very much.